everybody! How you doing? My name is Lady Weirdness, and welcome to another surgery game from Surgery Squad. It's called Lasik Eye Surgery. Paging Dr. Weirdness, paging Dr. Weirdness. What's the trouble? It's eye trouble, Doctor. Okay. Well, we're gonna get in, fix somebody's eyeball. Let's do this! Ba, 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 ba.
Welcome to Surgery Squad's virtual LASIK eye surgery. I am Dr. Susie. I'll be guiding you through a LASIK eye procedure today.
Hello.
LASIK eye surgery reshapes the cornea to provide improved focusing power and reduce a patient's need for glasses or contact lenses. LASIK is performed with a special laser that's used to change the shape of the cornea, the part of the eye that controls and focuses the entry of light. By doing so, we can focus the light so that the patient's vision is improved. Our patient's already had her preliminary exam. Her prescription hasn't changed for more than a year, and she has no history of eye disease or injury. This qualifies her as a perfect candidate for the surgery. We want to make this procedure as pain-free as possible.
She looks like she's
so
seen
we'll
a
use
ghost.
drops to numb the eye. Can you place a few drops into her eyes?
She looks like she's seen a ghost, like, oh my gosh! Hey lady, I can see up your nose. You got any boogers in there? Are they clean? Boop! I always hated the drops when I got my eye checkups. I don't like it.
Even with the numbing drops, it's possible that the patient can feel pressure and mild discomfort, but they do help with most or all the pain. Debris can complicate the procedure, so we need to make sure that the area around the eye is clean. Now that the area around the eye is clean, we'll use a device called a speculum to hold the eyelid open wide. So let's get that speculum
that thing
over
looks
the eye.
vicious. Oh my gosh.
If the patient was allowed to
Oh my
blink,
gosh.
we might cut or burn the wrong area. At this point, we'll also mark the cornea with a water-soluble ink to guide replacement of the flap.
That's cool. It's like a.
Now we place a suction ring over the eye.
That's cool. It's like a eyeball tattoo. That's pretty neato.
The ring sucks the cornea upward, making it easier to cut.
Oh,
The patient's
gosh.
vision will likely dim and blur while the suction ring is attached. For this next step, we're going to slice open a flap on the cornea. To make the corneal flap, we use a mechanical microkeratome. This is a fancy name for a blade device that's attached to the suction ring. We slide it across and it cuts the top 20% of the cornea. Here we go. Slide the microkeratome along the track to create a thin flap in the cornea.
I do have to say this. I do have a story where I accidentally cut my eye with the tip of a pencil. And it was not fun at all. So, I know about cuts on the eye, and they're not fun. So this is a little weird. Oh my god, what the frick? Okay. And the way that happened was, and the funniest thing was about it was on Friday the 13th, the most unluckiest day of any day of the year. And the thing was, I had my head down on my desk resting, but I was writing an essay, and I made a mistake, and my face was pretty close to my paper anyway, because I was resting it. So I went to flip my pencil over to erase it, and the tip of my pencil with the lead hit my eye. I didn't even know it cut my eye until I went to the eye doctor, and they said, she cut her eye, but my eye was watery. It felt like there was something discomfort, like something that was, like it was itchy. It was not fun. And then I had to wear, medical gel or something in my eye, and then I had to wear an eye patch. And it was not fun at all. Like, oh my god, I have to go to school like this. This was back when I was in the 8th grade. And, when I finally, my eye was healed and all, and we took the eye patch off, my vision was so different from eye to eye because the eye that was healing, I guess, got weaker, and my other eye that hadn't been injured was far stronger because I was using it more. So I had to wait until I could see properly, which took like a few days, until my right eye got stronger enough to be equal with my left eye. So the whole eye cutting process is not fun at all. So here we go. Boom! It just like deflated.
With the corneal flap cut, we remove the
Not even cut all the
microkeratome
way.
and suction ring and then peel back the corneal flap to expose the middle part of the cornea.
Run that by me again? We peel it? What do we even... Oh my god. Where the frick is it? Why is it glitching out? Stop that. Oh my god. Peel.
This is the part we'll
Oh my
reshape with
god,
the
that looks
laser.
weird.
The computer-controlled laser is positioned over the eye. By analyzing our patient's data, we've pre-programmed the laser to tell it how much corneal tissue to remove. A flip of the switch to fire up the laser and the reshaping process is underway. Pulses from the laser will correct the shape of the cornea in less than 60 seconds. The laser makes a slight clicking sound and you might notice a faint smell similar of burning hair.
Ugh, nasty.
And that's it. Please fold the corneal flap back into the original position. Nicely done. While you were working, I went ahead and took care of the other eye.
Oh, thank you.
We will observe our patient for several minutes to assure the corneas bond correctly. The cornea is quite
And
amazing
when she
in this
blinks,
respect.
it's not
It will
gonna
be bonded back to each eye in
gonna
moments.
feel nice.
Even with the corneal flap bonded back in place, the cornea is still vulnerable and could dislodge if the patient isn't careful.
Yeah, like
That's
you
why we
blink.
put a clear protective shield over each
I
eye.
didn't get one of those.
This keeps the patient from bumping
I got
or
a
rubbing her
band-aid for
eyes.
my eye.
The patient will notice the improved vision immediately, or as soon as the numbing drops wear off. She may now be driven home, as she won't be able to drive for a day or two. She'll come back within the next 48 hours so we can remove the eye shields, test her vision, and examine her eyes to make sure everything is healing up nicely. And there you have it, another successful surgery. You can see more of my superior surgical technique and my other procedures here on surgerysquad.com.
Awesome, Susie. Anyway, so that was cool and a little weird. But that was fun. I liked that. That was really fun to do. I really enjoyed that. Another surgery for Dr. Weirdness. I really like these surgery games on surgerysquad.com. They are so much fun to play. They're free. They're awesome. I do want to do more EdHead games because they have more surgery games to do. If you check out my surgery games playlist on my channel, you will see I do have one from EdHeads. Although I do have to... EdHeads is the thing where you have to pay for certain games. They do have some free games to do. Not all of them are surgery games. But I can't even speak. I used to play EdHeads before they had started having membership and stuff like that. And all the games were free to play, and it was so much fun. I am a little sad that I have to pay for it now. But I do want to do more EdHeads surgery games. Mostly because also they have like pop quizzes, so they test your smarts. So that's always a bit fun, you know. Pop quiz, you know. Anyway, but EdHeads is a lot of fun. They don't only do surgery games. They have weather games. They also have compound machines and so much more. You can design a cell phone for senior citizens. I think that is fantastically cool on EdHeads. But again, I'll have to see about doing another episode from edheads.com at a later date. But I do want to do another episode from there. But for now, I'm really liking Surgery Squad. I hope you guys are liking it as well. I hope it is fun to watch. And also, you guys can go and play it as well. It is free. So go and be your own doctor, saving people, doing surgeries. So, and just have fun. That's the biggest thing about games that I always love, is try to have fun. If it's too serious of a game, yeah, sure, maybe it's a little fun, but you gotta make something silly up. You know, get silly with it. It's awesome. Anyway, but thank you all so much for watching. If you like it, bang the like button, like a pro, and I will see you guys in the next video. Bye! This is Dr. Weirdness saying, I am out.